Hi there and welcome back. Dr. Zhu here again, and I just wanted to thank you for taking the first step towards health and wellness in our office. Now that we've both gathered and collected a lot of information on that first visit, I will walk you through what to expect for the second visit that's upcoming. So for today, we will review what we specialize in, what to expect on your second visit, show you our model of the journey to healing, and give you an example through our proven track record. Our specialization. So as mentioned before, I use the Gonstead technique for adjustments. I am a Gonstead diplomat, which just means that I have a higher degree in that technique. And the reason why I love it so much is because it is gentle and precise. And with that, it's gentle enough to be used on patients of any age, and the precision that we're able to attain for each joint of the body allows for us to get the best outcomes for our patients. As a family wellness chiropractor, I'm also very well versed in one of the most delicate times of our lives, which is during pregnancy. Being pregnant myself twice, I know that reducing stress to mom is very important because mom stress equals baby's stress. And the Webster technique allows us to be able to do that. And how that works is it helps to reduce the stress and strain on the mother's body that's changing very quickly, and in turn reduces that in utero constraint for the baby. We also use the principles from chiropractic biophysics to create curated spinal care in the form of structural rehab for our patients. CBP is one of the most well-researched techniques, and their specialized equipment allow us to create a unique setup for the unique needs of our patients. What to expect? On the second visit, it's approximately 30 minutes, and it's to review findings and how they relate to your health concerns and what we can do about it. So prior to your visit, we just ask that you come prepared with specific health goals in mind and any questions that you may have so we can answer that for you and go over that in detail. On the day of your visit, from here on out, there's no specific clothing that's required. However, if you prefer to stay in your own attire, then we just ask to wear open back shirts if you prefer. If you don't want to deal with any of that, we always have gowns here to borrow again. So the second visit is called our Report of Findings Day, and this is where we review the findings of your x-rays and other test results. We review your goals and we present our recommendations in a custom plan for you, and this is where you would receive your first adjustment if you so chose to. Journey to healing. We know that the natural healing process has ups and downs. And so what we wanted to do is share the overall process with you so that you know where you are in the healing in this model. So as you can see, there are 3 phases of care: relief care, corrective care, and wellness and maintenance. In the relief care, the goal initially is to get you out of pain without dependence on other means. Dependence on other means would be things like a walking stick or a cane or over-the-counter medications, etc. Pain is typically the last thing to show up, and it's the first thing to go away. Once that is resolved, we move into corrective care. This is the most important phase because it's the choice to continue care to change the underlying structure. Underlying structure does not change as quickly as our symptoms do. And so this one arguably would have the most consistency and also the most things that you would need to do inside and outside of the office in order to be able to achieve that change and bring that body back to balance. Once we're made the changes that we're happy with, we transition to wellness and maintenance, where we will aim to keep those improvements with periodic checkups and wellness adjustments if necessary. A proven track record. Although we cannot guarantee results, we can share that change is possible, and that change can often comes with improving your quality of life. So what we see here is a pre and post x-ray study of a patient. So in the first image, you will see side views of the neck, and we'll see green lines that show us where normal is and where we should be. And we'll see red lines to where the patient is measured in comparison. Ideally, the red and green lines should overlap each other and be really close. But as you can see in that upper left-hand corner, this is the initial side view of the neck of the patient, and that those red and green lines don't match very well. Then we can see below that is a follow-up study after completing corrective care for this patient, and that red and green line are a lot closer together. Similarly, we'll see to the right of that two full spine views. The left full spine view is when the patient first came in, and then the right view is their follow-up after completing chiropractic care as well. Again, this is the same patient, and that's the same duration of time from that corrective care. And you can see that, again, the red and the green line are very different when they first came in, and then they become closer and a little bit more balanced when they are in that follow-up study. Are they perfect? No, but they're closer together and the body is more balanced. And as a result, does that person have less pain and discomfort, and are they thriving? Actually, for this person, yes. So I hope this gives a little bit more clarity and prepares you a little bit better for our next visit, on your second visit here. This is our information in case you need to reach us again. We'd love to hear from you if you need us. And again, thank you for watching this video, and we look forward to seeing you soon.